recent study conducted by the University of Calgary reveals some promising early results in the role of exercise during the recovery of children battling cancer. Now, this innovative online program uses creative methods to transform exercise into a playful and engaging experience for young patients. The lead researcher of the study emphasizes that while healthy children naturally run and play, those grappling with chronic diseases tend to become less active, especially during treatment. The study's findings underscore the importance of addressing this gap in care. Well, joining us now to discuss this further is the Kids Cancer Therapy Study Lead and Exercise and Cancer Researcher, Dr. Nicole Curlos-Reed from the University of Calgary. Dr. Curlos-Reed, thank you again for your time today.
Thank you.
So can you walk us through this interesting study and why it was conducted in the first place?
Sure. So the study is really built to understand how we can implement movement or physical activity or exercise into cancer care, specifically for children while they are on treatment. It is an ongoing study, so we are recruiting right now across Alberta with hopes that with our findings, we'll be able to really build a model to implement this across hospital settings across Canada.
And just how big of a difference did exercise make in the recovery of pediatric cancer patients? Can you tell us a little bit more of the results so far?
Yeah, there's a lot of evidence. It's not necessarily the results yet from our study, although we do see it on a case-by-case basis in terms of the benefits the participants, the children experience, as well as their families. But we know from the larger body of evidence that the exercise or a movement program can provide not just the fitness benefits that many of us think about, but also things like enhancing their sense of well-being, their control, and management of many of the treatment-related symptoms and side effects that many of these children unfortunately experience as they go through the cancer journey.
And considering we are talking about cancer patients here, how do you ensure the safety and adaptability of these exercises for children who may have varying physical abilities or energy levels during their cancer treatment?
Yeah, absolutely. And that really for us comes down to how we screen them before they come in so that we can then tailor their exercise prescription, just like they'd be given a tailored medicine prescription to treat their cancer. It also comes down to having very well trained and qualified exercise professionals. So those individuals working one-on-one with the children in that online environment that our program has delivered have had the training and the expertise to be able to build a very safe environment for each and every child that is tailored to meet their unique needs.
Now, I know this study is being conducted in Alberta, but for our viewers, what kind of role can parents or caregivers play in supporting their children's participation in exercise programs, and how can they get involved?
Yeah, the parents and caregivers are absolutely essential. We know they are the gatekeepers of their children's health. And so informing them and providing them with the resources to really support the integration of more movement into their children's life, whether it's through this study or whether it's just while they are going through this cancer journey. We have our parents integrally involved, depending on the age and the needs of each child, in each of the sessions as a support person. But it also helps build their confidence when they can see their child engaging in these activities, and it makes them more certain that they can have their child be competent and do these things as well as then their other activities that they want their child to get back to.
In a way, it's helping the parents as well. So what kind of feedback have you received from healthcare professionals and the medical community overall regarding this study?
We have some amazing champions within our children's hospitals here in Alberta, but also as we build the team out across Canada. Dr. Amanda Wirtz has been one of our champions and the co-leads of this project. And she's been working with various health networks and children's hospitals to really build the confidence, provide the evidence, and then get those key stakeholders engagement in the project, which is absolutely critical for implementation across the cancer journey. We have to have the healthcare providers, the nurses, the oncologists, the rehab professionals, social workers, child life specialists. Everybody has to be involved and really bought in for this to be implemented and to have its effectiveness.
All right, ma'am, just a quick 45 seconds left here, but can you share any future research or projects that you may be working on that are related to this topic?
So we have a number of different programs. We've had yoga for young children and adolescents with cancer. We have a young adult program, so kind of 18 and beyond, a yoga program. We have adult exercise oncology programs, and all of our work really does focus on moving it from a really controlled lab setting into the real world, whether that's the hospital setting or whether that's the community-based setting. For this children's work in particular, we hope to see Impact really become the model that can be integrated across children's hospitals in Canada.
Well, looking forward to following your research. Dr. Curlos-Reed, thank you again for your time today.
Thanks for having me.